That sounds great.
And if you happen to hear a doorbell, people are just joining, so just go ahead and talk over it. So, okay, well, welcome everybody. Thank you for joining us. Happy Indigenous Milk Medicine Week. It's been an exciting week. If you were checking us out on Facebook, so many people shared their stories and pictures. It was amazing. So if you know of anyone who still wants to share, tell them to get in touch with us. We're still sharing all those stories and want to continue to do that. I think people really enjoy connecting with others about their breastfeeding journey. So please do that. So today we are just going to do, we're calling it Breastfeeding 101, kind of the first 2 weeks. And we are very fortunate that Kathy Lewandowski, who is an IBCLC, Kathy, I know you've been with WIC for a long time. I won't name any numbers because I don't really know, but I know it's been a while. But very supportive for the community in at the Menominee Tribal Clinic and Menominee Nation. And then Polly Martin, who actually has only been with WIC again the second time around for about a year. But Polly has experience with labor and delivery as a nurse in a local hospital. So just two very, very knowledgeable and experienced trainers for you today. They're encouraging you to ask questions, or if you want to share stories or experiences that you've had, you know, feel free to just chime in if you want to put it in the chat or take yourself off mute. They really want to be interactive and connect with you as well. So feel free to ask questions, share your experiences. And with that, I will hand it over to Kathy and Polly.
Okay, thank you. And thanks for joining us. So I think I'm going to just start a little bit by talking about maybe right before birth when you were admitted to the hospital, and then talk about delivery and then your first day at the hospital following birth to kind of get some good ideas on what you can do to get breastfeeding off to a really good start. So let's talk about when you're admitted. And when you're admitted, your nurse that admits you will go through all sorts of things with you and talk to you about your wishes, your desires, as well as going through your vitals and getting you hooked up to the monitors. But when you are admitted, be very vocal as a patient about telling your nurse what you would like, and skin to skin is the number one thing that we would like to see with happen for you to make your breastfeeding journey get it off to a really good start. And skin to skin can be done and with a C-section too, very successfully. I helped a friend 2 weeks ago with a C-section. It was her second baby, and first baby went well, but it wasn't exactly what she wanted with skin to skin. That baby went skin to skin with her within 5 minutes of birth, and that baby was breastfeeding within 15 minutes of birth, and that baby did not come off of her. We held that baby on her to her while we scooted her over to she held the baby while she was getting her incision closed, and then we just held on to baby while we scooted her over to her bed to go back to her room. So there's a lot of things that are very doable, whether it's a vaginal C-section birth. But so with labor, and once you pushed your baby out, as long as that baby is nice and stable, the baby will go right up on your chest with warm blankets. There'll be a nurse there to check baby out, and she will be doing that head to toe assessment while you're holding your baby. And as long as that baby is vigorous and pinking up nicely, crying a little bit, that baby can stay right on you. Sometimes we can't get the baby real close. If the cord is a little short, we can't always get the baby right up to breast, but we can get the baby as close as we can. Once that cord is clamped, baby can come up right up to breast, dry the baby off, put a little cover over, a little hat on baby's head so they stay nice and warm. And baby should be able to stay on you as long as you want. And that's one thing I would really like to stress. As long as your baby is nice and stable and doing well, there is no reason that baby has to come off of you for as long as you'd like that baby on there. We have moms that go skin to skin with the baby for 3 to 4 hours following delivery. Your nurse can come over and do assessments on the baby. Your nurse can do the vitamin K shot while you're holding your baby. The antibiotic ointment in the eyes can be done while you're holding your baby. Heart can be listened to, lungs can be listened to, temperature can be done. So be a little bit assertive, or have your partner be a little bit assertive for you, that you would just really like to hold that baby as long as you can and get breastfeeding off to a good start. And then what we would watch for are signs that your baby is hungry while you're holding your baby. Some babies will nuzzle their way right down to the breast. Otherwise, what we would be watching for is baby licking their lips. The eye movement and baby looking around, baby nuzzling in like they would like to nurse. And then we could let the baby lead themselves down to the breast, or as you could have your nurse and ask for a little help to get baby moved down a little bit closer to the breast to help with breastfeeding. So that's what I would really encourage to get your breastfeeding off to a good start. And there's so many good things about breastfeeding, or about the skin to skin. Helps with breastfeeding. It will help stabilize your baby's temperature. It will help stabilize your baby's blood sugar. There's just so many good things about having your baby skin to skin with you right from delivery on. So oftentimes as a nurse, I will agree that sometimes I do this. You get very task oriented. So your nurse might want to get a weight done. Your nurse might want to get a length done so she can complete her charting, but those are not the important things. The important things are having your baby right on you and getting breastfeeding off to a good start. And studies show that the success rate of breastfeeding is increased. I wish I could give you a number. My mind is coming up to about 40 to 50% by having baby skin to skin with you for the first few hours. There won't be a diaper on baby. We could sneak a little diaper under there. We could sneak a blanket too. And if you would need to get up to go to the bathroom, which oftentimes moms do within the first couple hours, have your partner or your support person do skin to skin with your baby. So if you need to get up and go to the bathroom, we can arrange so that baby can just be scooted right over to dad or your support person's chest. Put a warm blanket on baby while you get up and use the bathroom and get cleaned up. And then once you get right back to bed, baby can be put right back on you. So any comments or any experience that people have had with their immediate post-delivery experiences at the hospital that you'd like to share, or questions I can answer, or anything about that first few hours after delivery, I'd be happy to answer those. And please speak up or just put something in the chat if you have any comments. I think I hear something, but I'm not sure. So I'll talk about a little bit more then about, that first day at the hospital with breastfeeding. Rooming in should be done. I don't know what kind of bassinet situation your hospital has. I work at the Marshfield Hospital in Minocqua, and we have nice cribs that go right up next to your bed, nice little halo bassinets that go right up next to the bed, have a side that can come down. They can go over the bed for moms who've had C-section, so it's really convenient for getting baby in and out. But the more you have baby in the room with you, the more you will learn their cues and when they're hungry and when they need you. So it's really nice to be rooming in with baby, and then just feeding a baby on demand. And anytime baby shows any signs of wanting to eat, put that baby to breast. And a lot of moms don't even get the baby in the bassinet. They're holding the baby, for those first, 6 to 8 hours, and then they're responding to their cues right away. So demand feeding, whenever baby seems hungry, put baby to breast whenever they want to eat, and ask your nurse for assistance with different positions. We usually use pillows to help position, but if you have a boppy pillow that you would like us to help you use, we would be more than happy as nurses to help you get baby situated, show you different positions. With moms who've had C-sections, oftentimes a football hold is a really good position to use to keep pressure off the incisional area. Laid back position is wonderful too for both vaginal deliveries and C-section deliveries. And then don't worry too much about length of feedings. If baby is on for 2 minutes, 5 minutes, 10 minutes, some babies just get latched on and don't want to come off. Let them nurse as long as they would like to nurse, and then when they seem hungry again, put them back on for feedings. Make it clear to your nurse that you do not want pacifiers used. You don't want supplemental feeding unless there's a medical reason to. And if they talk about a medical reason, make sure you have an opportunity to discuss that with your pediatrician to know what that medical reason would be and why they feel that needs to be done. Um, and then what else? Those would be the really big things. Those first 24 hours, get that baby to breast as often as you can. Lots of skin to skin. The pediatrician at the hospital should be coming in at some point during that first 24 hours to check in on baby. Some hospitals are fortunate enough to have lactation consultants. At the Minocqua Hospital, we have myself and another nurse who are lactation counselors. So we are when we are there, we'll certainly help moms, and we can be called in for advice too. But I think most hospitals have lactation consultants that can give you some assistance. So, and then of course we're looking for pees and poops. The first 24 hours, we would like to see one pee and one poop from your baby. And it's nice either to have an app on your phone or a printed out piece of paper where you can keep track of feeds. So we can help you if we feel like help is needed, or if we feel like baby should go to breast more. If mom's had a long labor and is pretty exhausted, there might be times we're gonna wake mom up to assist her with feedings, but otherwise it's more just demand and getting baby to breast as often as they need to go to breast. And I see we have a chat there. Can you read that, Sherry? I can't see it all.
Yes. Just wondering if others have had experiences with nursing staff who don't seem familiar with the benefits of breastfeeding and don't provide much support around breastfeeding, especially when baby loses weight after birth.
And I see we've got a response.
Oh, yes. So true. Had 3 children, and the most successful one was my last child, skin to skin immediately after birth with him for about an hour.
And that's fantastic. I would say that we expect babies to lose weight before they're discharged from the hospital. Usually it's about 7 to 8% of body weight they lose. And that's not alarming to most nurses. It's not alarming to physicians. If we see babies' weight loss go up around 10%, then what should be done, and if it's not, you can be a little bit of an assertive parent and about it, but what should be done is just working with getting baby breastfeeding more, get that supply and demand going more, checking on latch, checking on position, and just making sure that baby is off to a good start with breastfeeding. We find also that if mom has had a long labor and has taken on a lot of IV fluids, that the baby's weight will be a little bit distorted because of that. And then their weight loss can look really like a little bigger than it should. And then the other thing too is just a nice follow-up, whether it's with the public health nurse or your community health nurse, or getting back to the clinic within probably about 24 hours of discharge, which we'll get to too as we talk more for follow-up to check that weight. Some babies just gain a little slower. I just followed a baby, and usually you like to see babies back up to birth weight by 10 to 14 days. And I had a baby that was doing wonderfully, content between feedings, peeing and pooping, but took about 3 weeks to get back up to birth weight. But all the other signs were looking good. So I think you need to as nurses, they should be able to look at the big picture rather than just one certain item, and the pediatricians also. So I would agree that not all nurses are well educated and well trained with breastfeeding. And I know from our hospital here in Minocqua that there is such a nursing shortage now that we are getting a lot of new grads. So they are learning so much in that first 6 to 12 months when they start. They're learning labor, they're learning delivery, they're learning newborns, they're learning postpartum, and we try to get breastfeeding education in for them also, but a lot of them don't have children of their own. So it's a little, there's a lot to learn. So if you don't feel satisfied with the responses you're getting from the nurse or the support you're getting from the nurse, there's nothing wrong with asking if you could speak to someone who has more experience with breastfeeding. No one's feelings will be hurt, and a mom's stay at the hospital is so brief. We have a lot of moms being discharged at 24 hours. Even 48 hours isn't much time to get a lot of education and a lot of support and to get breastfeeding off to a wonderful start. So
I really liked your comment, Polly, earlier about how you mentioned it in relation to supplemental feeding, but I think it applies across the board that if that's not something, ask for the explanation and really get more information about that. I mean, it's ultimately your decision how you want to feed your baby and how that's going to work. So I really appreciate that you're bringing that forward and reminding families that it's well within their rights to ask the questions, ask for different information, or ask for more experience. So that I think that's great.
And I always like to think of a patient as being like if you were going to a restaurant and your patient is your customer and you're there to please your customer. I think sometimes as patients we feel like we need to do what the nurses tell us to or do what the doctors tell us to, and you're the customer, you're the person who needs to, as long as everything is medically stable, you need to make your, like you're in a restaurant, put your order in and you expect to get what you ask for, whether it's, I want help with breastfeeding, or I want my baby skin to scan, or I want a good reason why you're doing this. So important things for sure. So
and
go for it, Kathy.
Okay. I was just going to say, I would add to that too, that, a new mom who maybe isn't aware of any of this is maybe going to be more likely to just go along with whatever she's told. Whereas, someone who is trying to learn ahead of time, like, for example, listening to something like this, is going to know a little bit better what to expect and to know what to ask. So yeah, hopefully people are getting prepared ahead of time. So anyway, yeah, so second day, I was very appreciative of Polly being able to explain the stuff from the beginning because I work in the WIC field, not the hospital. So usually it's day 2 or 3 before I start talking to them. You might be home discharged already, or you might still be in the hospital at this point. So typically by like the second day, baby's a little bit more awake and alert, not, totally awake and alert, but a little bit more than they were the first day, and wanting to nurse frequently. And that is absolutely normal. I think sometimes we talk to people who think the baby wants to eat all the time, they must be starving and I must not have any milk, so this isn't working. But that's normal newborn behavior. They have a tiny little tummy, and the little, maybe teaspoon of colostrum that they get each time they nurse, digests quickly. And they're also not just hungry, they want to come back to mom because that's where things are warm and good and it's comfortable, and that's where they want to be. So it's not just always about eating, but so yeah, it could be once an hour, it could be every 3 hours, but just kind of keep watching for those cues that baby is hungry. And these feedings are going to take a little while because you're both new to this. It's going to take some time, but that's okay. It's an investment that will pay off later. Let's see what else. Try to offer both breasts if you can, but don't, let them stay as long as they want on the first one, burp, things like that, then offer the second. Let's see, if baby might be tired and falling asleep at the breast, there's things that you can, ask for help, and some things that you can do to try to wake them up, burping them a little bit more frequently, changing position, rubbing their feet, just different things like that to keep them awake. Again, with the diapers, we always look to the clues, what's going on with the diapers. First day was one wet and one poopy diaper. Second day, we're looking for 2 of each, hopefully. So that's going to be a clue of what's going on. Mom, maybe your nipples might be starting to get a little bit tender at this point. If you haven't breastfed before, the tenderness is normal, but like pain, cracking, blistering, that wouldn't necessarily be considered normal, if that's happening, you should be asking somebody for some help with that. Because if that continues, that's just going to get worse and you're not going to enjoy this experience at all. So you can do things like rubbing some breast milk on there or some lanolin, just letting them air dry, and definitely reach out to somebody to get some help with that, because it might be related to the position or how they're latching onto the nipple. And if you can get some help with that right away, the sooner that gets fixed, the sooner that will improve and get better. Let's see what else. You know, whether you're still home or in the hospital, maybe you have visitors that all want to come and see the new baby, which can be great if they can do things to help you, as long as, and again, if you have that one partner or support person that can kind of keep track of that for you a little bit and say, they're both kind of tired. I think, a brief visit is good, but then they need some time to themselves again, kind of monitor that for you. So, anybody have any questions or comments related to that? Just looking at my notes. Yeah, I think that's about all I had for the second day.
I might just throw in a couple comments when you mentioned first-time moms. If
Sure.
anyone has the opportunity to have the support of a doula, who can be with you at delivery or post-delivery, they are wonderful for helping with breastfeeding. And also, if mom doesn't tend to be an assertive person or isn't comfortable asking questions or questioning the nurse, I think the doula is a wonderful person to be able to help with that, and support, whether it's a first baby, second baby, third baby. I think I'm finding when I do my home visits and I'm visiting moms who've had babies before and breastfeed babies before, often the discharge nurse at the hospital will assume they know what, they'd have no questions, which is a terrible assumption to make. I don't think you can assume that every baby's going to be the same, every breastfeeding baby experience is going to be the same. So I feel like every mom should be provided the support and get the questions answered, or even just run through the whole experience of what you can expect when you're breastfeeding that baby, and different positions and different suggestions, because every experience is different. I have found lately that I've had several babies who have had tongue ties, and if along with positioning, sometimes a tongue tie can cause discomfort too. So don't hesitate before you're discharged from the hospital to ask your pediatrician to check to make sure your baby doesn't have a tongue or a lip tie, because that can make breastfeeding a little bit more of a challenge too if there's a tongue or lip tie. So these would just be a couple suggestions prior to discharge. When you mentioned visitors, Kathy, it made me think that I felt like when we had COVID restrictions at the hospital, for visitors, I felt like breastfeeding maybe went better for moms, because they didn't have people knocking at the door, coming in. I feel like they were more comfortable, just because they knew there weren't people coming in. And sometimes it seems like moms will put it off of feeding rather than ask visitors to leave when they start seeing those breastfeeding cues. So remember that if your baby starts acting hungry and maybe you're not quite comfortable yet feeding in front of someone, ask the visitors to just go for a little bit, and your partner or support person can go get them after the baby has a feeding. And the feeding can take an hour sometimes. It's not going to be like pop the baby on and you're done in 10-15 minutes. It can be kind of a long, your feeding's going to take a while. So I'm just looking at a comment here.
Yeah, you got a great comment from Dawn. Having a partner advocate for limiting or no visitors is huge for establishing breastfeeding. Having my in-laws around 24/7 made me feel uncomfortable, and I was very grateful when my husband booted them from my space.
I think that's so true, and I think that happens at home too. You shouldn't be the person that has to leave the room when it's time to breastfeed your baby, whether it's in the hospital or at home, and you're comfy in the living room and you've got people there. You shouldn't have to get up and go to the bedroom.
Right.
You know, you should be able to breastfeed your baby wherever you're comfortable breastfeeding your baby. So, and what else? I want to mention one more thing. As a breastfeeding mom, and I don't know how the other hospitals in the areas are, but I know at our hospital we have pumps available to if mom is going to need a pump. I know it's ideal maybe to wait and see if a pump is really needed before you get a pump, but if we have a mom at the hospital who is able to get a pump, if you know, anybody who has insurance with the first baby should be able to. And Sherry, how many years is it between babies where insurance will cover a second pump? Do you for some reason, I'm thinking.
I feel like they're trying to eliminate that. I'm not sure what the current is.
Okay.
I think each insurance maybe kind of has their own rules,
Okay.
but you know.
I'm was trying to adjust that, so we'll see how long that takes.
Keep us posted on that. I'm finding if moms don't, the moms around here, if they don't get a pump when they're eligible to get a pump, if they don't get it from the hospital, oftentimes they don't get one. Whether it's jumping through the hoops with our home medical service or trying to get, sometimes when it's not done through the hospital, home medical is asking for paperwork about the baby. You know, they want notes from the doctor. So if you're able, ask your nurse about getting a pump or assisting you with the pump process, because so many moms are going back to work at 12 weeks and they will need a pump. Hand pumps are difficult sometimes for getting enough milk. So that's just something too I wanted to point out if you know you're going to be pumping, talk to your nurse prior to discharge, because they can have either the obstetrician or the pediatrician sign the order, is how we work it. And then we just have pumps available. We have Spectrum and Medela at our hospital here in Minocqua.
Okay.
So.
And I would just add to that too, just again, another thing for the moms to be aware of is that most insurances will pay for ones. So, you know, like if you're going to have a baby shower or something, right. Tell somebody to spend that money on something else. I can get a pump through my insurance, you know, right. Buy me a different gift. Don't buy me a pump for for my shower.
Very good point.
And Dawn added in the milk storage bags.
Right. Yeah. Excellent. Excellent idea. Day 3 to 5, Kathy, do you want to take that, or do you want me to start? And
I think that one was yours. So
okay, I'm ready to talk about data 3 to 5. That's where your milk is transitioning over from colostrum and transitioning over, and you might experience some engorgement. One of the first signs, I have twins, and I breastfed my twins, and I just remember the middle of the night, and of course you're exhausted and they're 3 days old and you haven't gotten much sleep. But I just remember my first sign of, I think my milk transitioned over, was just hearing my babies just start to gulp and swallow more. And it's like, I didn't feel the engorgement yet, but I knew that my milk was starting to transition over and become more plentiful supply for them. So days 3 to 5 are when that happens. Sometimes if you've had some blood loss at delivery, if you've had a hemorrhage, your milk might take a little longer to transition over. But in that 3 to 5 day period is when you will feel more fullness in your breast. Oftentimes moms will start to feel up in their armpit area, that they'll start to feel those milk ducts starting to fill. So a little bit of discomfort. Having a nice, comfortable nursing bra or some type of sports bra for support can be really helpful during those periods. You may find that baby, as your breasts are fuller and maybe a little harder, might have a little more of a challenge to latch, because your breast up to this point has been nice and soft and kind of pliable, and then it gets fuller and a little harder, and they might have a little difficult time latching. And that's when you can maybe do a little breast massage, a warm compress, just to kind of soften that breast up a little bit. Once in a while, a mom might need to, usually doesn't need to, but might find it more comfortable just to use a little hand pump just to get a little bit of milk off, just to soften the breast up so mom can mom can get baby latched on well. And then you will notice that you'll have your baby swallowing more. Sometimes baby needs to pull off once in a while because they're not used to that milk coming quite so quickly, especially if you have a nice letdown where your milk is flowing a little more quickly. Your baby might pull back once in a while and just get their breath and then latch back on. But you will find that that's when stools start transitioning over too, as they will go from the black tarry meconium in the hospital to the greenish color transitional stool. And then when your milk transitions over, you'll start to get the more curdy yellow colored stools with baby. But days 3 to 5, you might be a little more uncomfortable with if your breasts get engorged and a little fuller. Again, warm compresses, massage. Try to avoid, hot showers on those breasts if you can, but the warm compresses are good. And then nurse baby as often as they want to nurse too. And then your body will regulate that milk supply for you. Usually, in about the first week to 14 days, I find that your body makes that nice adjustment. You want to have some nursing pads, whether they're the disposable kind or the ones you can wash. Oftentimes when you're nursing from one breast, you will have milk leaking from the other breast. That breast will let down milk also, and you can have some leaking. So unless you want to walk around with those bullseyes on each of your nipple areas from milk leaking, you might want to put a nursing pad on the one side. But otherwise, days 3 to 5 are good days. Your baby might be a little more satisfied. Sometimes before your milk transitions over, when you're hitting that 2 to 3 day period, your baby, oh, my lights just went out because I haven't been moving in my room. Your baby might get a little frantic and want to nurse constantly, do a lot of cluster feeding because they're trying to tell your body to get busy and get that milk to come in. So you might find that around 48 hours your baby's just nursing because they want that milk to come in quicker. But once your milk does transition over, you'll find that they'll be satisfied and they might sleep a little bit longer too. Once your milk transitions over, but they still will most likely want to eat every 2 to 3 hours. They'll probably still do a nice amount of cluster feeding during that time to put on that weight that they lost again too. So anything you can think of, Kathy, with days 3 to 5? I'm gonna go get my light to come back on here in my office. There. Any other comments or questions about those days 3 to 5? Nope.
See anything. So I think we'll move on to, around day 6 or so, things are maybe hopefully starting to, get into a little bit of a routine. Every baby again has a different personality, and your baby might eat every 3 hours on the dot, or your baby might do the cluster feeding and then sleep for 4 hours, and that whatever that baby wants to do, that's normal for them. That's okay. As long as you're not going long spans of time without baby eating. Your breasts at this point, so by now hopefully some of that engorgement's going away, your breasts are softening up. This is just the swelling and inflammation going away. It is not your milk disappearing. You still have milk. Sometimes we hear from moms about this point in time that they think my milk just dried up and it's gone, but that's not what happened. That's okay. So you still have milk. You may notice that, they'll feel fuller before a feeding, and then after baby eats, they feel a little bit softer, and that'll just kind of every single time you'll notice that fluctuation. But they're not going to be as full and hard as they were for a couple days there. Maybe if you're lucky, the leaking will slow down. Everybody's different that way too. Some people leak all the way the whole time they nurse, and they use nursing pads the whole time. So let's see what else. So yeah, you're both getting more experienced. The feedings may start to be a little bit a little bit shorter, a little bit faster. It's still going to take quite a while for, you know, quite a few more weeks yet, but you're both learning a little bit more about each other and getting into a little bit more of a rhythm. Again, by this time, usually babies are having 6 wet diapers a day, and maybe 4 or more poopy diapers. And as long as all they're getting is breast milk, it's going to stay that mustard yellow color until they start either, you know, getting some food when they get older, some solids. That's the color it's going to be. So, and again, I think Polly mentioned this before, but typically by day 10 to 14, they're back up to their birth weight. Any other questions or comments about that stage? Not hearing anything. So if baby, I guess one other little trick, if baby at this point or anywhere along this stage, if baby still is a little bit sleepy and tends to fall asleep at the breast, another little trick that you can do is just some breast compression. So just kind of gently with your hand pushing on your breast a little bit as they're nursing, can kind of squeeze a little bit more milk into their mouth and make them wake up and remember what they're supposed to be doing is eating. So that can help a little bit. And yeah, I'm seeing a little comment here about the gadgets for collecting. Yes, that's true. There are several different things that you can put on the breast that the baby's not nursing from at that time to collect the drips. Instead of it just going into the nursing pad and throwing that out, you can actually collect those and then pour them out into a bottle or something for future use. So
I've had quite a few moms have really good luck with Hakas. Have you found it also, Kathy?
Yes. And there's a couple different, actually, yeah. So there's the original ones that came out, and then these new little Haka, what are they called? Ladybugs, that are even smaller and just collect those drips. Yeah. And I'm sure there's other brands as well, not just not just that brand. I just think an important thing to remember this whole process, you know, this whole experience is that, you know, every mom and baby are going to have a slightly different experience. And if everything that we just said up until now, that doesn't happen that way for you, that's okay. There are definitely, you know, different things that happen. But anytime that you just feel like something isn't right or you have a question, you know, reach out to somebody, and, you know, somebody with experience that can help you figure out whether that's anything to be worried about or if that's just a little different way that you're, you know, that it's working for you. But yeah, you know, if you can know ahead of time who to ask, here's a list on the screen of just some different people that you can talk to. There's all kinds of, you know, in the OB department, call them back, your local tribal health center, your WIC office. Some communities have some Indigenous breastfeeding counselors, doulas, your doctor, just like nurses. Some doctors have more experience with breastfeeding than others. Some of them are very well versed and very helpful. If you feel like your doctor is, you know, has good answers for you, you know, call them up. Just, you know, reach out for help to make it a successful experience for you.
And a couple of things came up too as I was thinking about your hospital experience.
Sure.
Ask your nurse to show you how to do hand expression.
Yes.
I think hand expression can be wonderful when you have some engorgement. You won't have it in the hospital, but you may have it at home. So if you could get some instruction on hand expression, that can be very helpful, just to soften the breast a little bit for nursing. And if you do get a pump at the hospital, ask your nurse to show you how to use it, how to set it up. Because that can be a little overwhelming when you get home also, is to, here you are and it's day 5 and you feel like your breasts are like 2 cantaloupes and they're so hard and you just want to be able to relieve a little pressure, but now you've got to figure out what to do with your pump because nobody's really shown you what to do with your pump. So that's something good to do in the hospital too. And you've got the combination of being exhausted and being overwhelmed and being in love with this new baby, and you have so many things going on. So um, so many people want to get home at 24 hours, but 48 hours is so nice to be able to stay for some extra education and help at the hospital, to get some of those things, get assistance with some of those things before you leave the hospital. So those would be a couple suggestions too. And there's things that Kathy and I didn't talk about, and those are things like what you do when you have a baby that won't latch, or pumping and maybe doing a little finger feeding. But those are things a lactation consultant would be excellent to help you with. So we're kind of just covering the norm, how most things go. And there really is nothing 100% normal about it. It's normal, but there's always exceptions, and there's always little quirky things that can happen with each baby. But that's when you can seek out some help from a lactation counselor. Another great resource that I found is trying to get hooked up with, now that COVID has kind of settled down a little bit, mom groups, whether they're story hours at the story time at the library. You might make some good connections, especially if you're new to the community. Just meeting moms who have had breastfeeding, and it's so nice to have that support of family and friends. And you might also find a really new connection with family members that you really weren't real close to, but when they find out you're breastfeeding, they might be your best support people too, and come help you. Kind of have to learn to weed out the helpful information, and then kind of just like with labor, the stories that you really don't want to hear, that maybe when things don't go well for people, but there's some wonderful family members that can also be so much help and support for you with breastfeeding also.
Another thing I would add about the pumps, I like that idea of learning how to put it together and use it at the hospital if you do get it there. Some of the moms in our area, they tend to get shipped to their house. So they're, all of a sudden here's a box on your doorstep. So one thing I like to tell the moms, and this isn't the case, sorry if I'm making a generalization, but sometimes, your partner might be more mechanically inclined than you, not always. And, since sometimes they maybe feel a little bit left out because you're doing all the breastfeeding stuff, can you figure out how to put this pump together for me? Read the instructions and put this thing together. Or maybe your father or your father-in-law or somebody, put somebody else on that project, but you definitely need to learn how to use it. But only to involve other people. Oh, and then too, the hand expression you mentioned. Another really good place where that can be used is if that first feeding in the first hour or whatever doesn't go well, that's also a good time to hand express and just try to give the baby that colostrum off of a little spoon or something, right? Is that, it's so thick, it doesn't tend to come out very well with the pump. So I think hand expression will work a little bit better for that.
I'll move to your credits too, but if you have any questions or other comments, experiences that you can share, feel free to unmute or put in the chat.
I guess one last comment from me is, if you can, once you get through 2 weeks, it's usually a breeze. Those first 2 weeks are hard. So don't be surprised if those first 2 weeks can be challenging, because they are.
Right.
Your body's recovering. You're learning how to feed a baby. You have a new human to take care of. So give yourself some grace and
Mhm.
just say, okay, this is hard, but I can do it. um, and just hang in there. Once you usually hit 2 weeks, things have really have gotten so things, it's just better. It's just better, and it just happens easier, and you're more comfortable with everything regarding breastfeeding. So
Yes, great comment to end on. Anything from you, Kathy, to end or?
No, that was a fabulous comment. Yeah,
Yes.
those first 2 weeks may not be Instagram worthy, but just, enjoy it as much as you can. You're never going to get that again with that baby. So, at the end, you'll be proud of yourself, realizing what you were able to do.
Well, thank you both so much again for talking about this. Like you said, that first 2 weeks I think is critical. So having a little information, and we did record this, so we will be sharing it. And I think if you're working with moms that maybe they've done the breastfeeding classes and all this the stuff we want them to do, but I think just really listening again to some of these comments that Polly and Kathy have made, it just, I think, brings it back together, like just reminding you of some of these key things to know. So be sure to share the link when we share, when we get it posted for you. I think it could be useful to families, as they're at home, they can just chill and watch this with some great information about those first 2 weeks. So thank you guys again. Thank you guys, everyone, for joining us. Remember, there's still some Indigenous milk medicine happenings the next few days on the national level. You can check out our Facebook to see what some of those are. Otherwise, we'll let you go. And thanks again, you guys, for this amazing presentation.